Breast Cancer Awareness Month starts tomorrow, and this morning we are talking about the importance of early screening and knowing if you are at risk. Breast cancer is the second leading cause of cancer deaths in women, and 1 in about 8 women will be diagnosed with the disease in their lifetime. And there is a continued rise of women under the age of 50 being diagnosed, which is pretty scary. CBS News chief medical correspondent Dr. Jon LaPook is here with what you need to know. Dr. LaPook, welcome. What do people need to know?
Well, in terms of screening, have the discussion with your healthcare provider. I mean, there are a lot of different factors there. A few of them are advancing age. Do you have a family history of breast cancer or ovarian cancer? What was the age of your first period? Because the more the cycles, the more times that you have a surge of hormones, and that can increase the risk of certain kinds of cancer.
So if you started, if you were a little younger.
And we're seeing that hormone replacement therapy, things like smoking and alcohol and obesity, and there are other things. So there are these applications, there are these things that people like Olivia Munn talked about, where you can put in various different risk factors and it'll give you a calculation. And there are a number of them. You can find them online, talk to your doctor about which one to get. But I think they're very useful to just really consider it.
These AI models that apparently can make predictions, how useful are they?
Well, there are two different uses of AI. One is, and I was actually there to see one of these demonstrated, which is you have a mammogram done, and the AI actually, even before the radiologist sees it, can put a little box around areas that are potentially dangerous. And the reason why that's important is that normal breast tissue looks white with fibrous tissue and regular breast tissue. A calcification, which can be indicative of, not always, but indicative of breast cancer, is also white. So it's like looking for a snowball on a snowdrift. And sometimes human eyes are not as good as the AI at finding it. The other thing that's really interesting, and this is research, is looking at hundreds of thousands of mammograms, and somehow figuring out what's the predictive value. And the early research suggests that you may be able to look at it and say, okay, this person, not now, they don't have breast cancer now, but in 5 years, maybe 10 years, maybe they're going to get breast cancer. I think that's fascinating research.
And remind me again, when are women supposed to start getting screened?
You know, the societies differ a little bit, but I think the consensus is around age 40. Shared decision making. So is it going to be every year, every 2 years?
Shared decision making with your doctor.
With your doctor. Let's talk about what your risks are and what your risk factors are. And of course, if you have very dense breasts.
What does that even mean? Like, I hear that all the time.
Okay.
Yeah.
So dense breast means that there's a lot more white. So what's causing it to be more dense is the presence of collagen, of fibrous connective tissue. And that looks white on the mammogram. So does regular breast tissue, just the epithelial cells that line the ducts that lead to milk production. As women get older, there's more and more replacement by fat. Fat looks black. So when it's a lot of black, it's easier to see the little white dots that we talked about. But when early on, dense breasts means there's a lot of that white. And then you can miss lesions. So they add on something else. And this gets tricky. I was talking last night with a breast expert. Is it a breast ultrasound in certain people at high risk who have very dense breasts? Maybe you want to think about an MRI and some other types of things. So this is something you really have to talk to your healthcare provider about. I love this discussion because this could not be more important.
Thank you, Dr. We really appreciate it.